Now let's dive deep into this big LGBTQ story for today. I'm Von Biggs, and let's queer up healthcare. Pan-patient research shows little healthcare understanding. Healthcare access and financial assistance are particularly affecting vulnerable communities. Recent research conducted by the Pan Foundation has revealed a significant gap in the understanding of healthcare plans and financial assistance among those living with HIV/AIDS and the LGBTQ+ community. According to the research, only 2 in 5 patients know whether their insurance plan uses common practices that could limit access to treatment or hike up costs. When it comes to financial assistance programs like hospital charity care, pharmaceutical help, or federal aid, only 21% of U.S. adults and 24% of those with chronic conditions say they're very familiar with these lifelines. And nearly 40% of the adults have never even heard of independent charitable assistance or pharmaceutical patient programs. It gets worse. Of those who needed medical financial help last year, 41% of the chronically ill patients didn't receive any. Many LGBTQ folks living with chronic illnesses are likely among those affected. Over 60% of patients with chronic condition said they are faced barriers using their healthcare plans. Confusion is widespread, with 42% of delayed care and 35% skipped medication, not knowing if it was covered or affordable. The internet and healthcare providers are the top places people turn to for help, but most say it's not enough. One thing is clear: patients want better education and clearer guidance. A staggering 87% of those with chronic conditions say they need more resources to navigate financial help and their healthcare plans. The message is loud and clear. Access doesn't just mean availability, it means understanding. We must prioritize patient education and support to ensure that everyone, regardless of their background or health status, can navigate their healthcare plans effectively and access the financial assistance they need. Together, we can build a healthcare system that is inclusive, equitable, and responsive to all the needs of all communities. Too many times in our communities, especially those living with HIV/AIDS and LGBTQ individuals, face a healthcare system that's confusing and fragmented. Access isn't just about coverage, it's about understanding and receiving comprehensive, coordinated care. When providers focus on their part of the care, they miss vital opportunities to collaborate and improve outcomes. We need a system built on education, integration, and true patient-centered care. You know, I find this interesting, this story, because I just dealt with this with my mom, actually. She called me and she was prescribed medication, and she went to go pick it up at the pharmacy, and they're like, oh, that'll be $197. Just like they have it, you know, someone who's living on Social Security can just, and she's like, why is it well, your insurance doesn't cover that prescription. So we see this happen, especially in our aging communities. I mean, we see this, they don't know until it's too late, or they go to a doctor and they're like, oh, this doctor isn't covered under that plan. You'll have to go to another one. And it just becomes barriers of care.
I mean, am I wrong in that many health insurance plans are written to be as vague as possible to benefit the insurance companies? Isn't that sort of...
Right.
Is it possible that could be part of the plan, that it's written that way so that, you know...
I mean, I think the way that health insurance plans are written, certainly for a layperson,
Right.
even if they offer benefits. I actually sat on a benefit panel at work about just getting to find out what was important to employees about signing up for benefits, all kinds of different, not just health benefits. And you know, one of the things on there was it was just very clear that people don't understand, and you know, especially if you work at an employer that has multiple health plans available, like the average person to be able to analyze them, and you know, things like AI, and there are some things that are out there now where they can do some prompts to ask questions, and you know, but again, it takes time to do that. It takes researching, is your doctor included on that, under that plan, and cross-referencing that, and you know, do you have a special condition, or might you be in a relationship with someone who has a special condition? There's so many nuances to these plans, and being able to pick the right one for you is very, very difficult. And I think there needs, you know, to be more resources out there, you know, nonpartisan resources. You know, obviously the insurance company, they have resources that are designed to help. Are they helpful?
Yeah.
No.
That's yet to be understood.
You think about it, they call and they typically change over, right? You could have the same insurance, and I'm not going to pick a name, but it's the same insurance company, and then the new year rolls over and you're like, I'm staying in the same insurance. But what you don't realize is they just changed like 250 doctors in your area and formularies, but you don't know that.
Well, and also you have to keep, I'm self-employed. I work for myself. So I have to do all my own homework. And there's blessings to being employed in a big company. You get that 30-day timeline where suddenly you get this barrage of, booklets on all the different options you have, and only 30 days to do your job, have your life, take care of your kids, your partner, your wife, your husband, your dogs. Oh, and make medical decisions with 6 pages of documents from each group, unless it's the white paper, I call it the onion skin, where there's 2-point type and it's covered for 45 pages, and you have to figure out what in the hell are they talking about?
Written in a language that's
you don't understand.
No.
So maybe we should work on something of that here at the channel, where we sit there and we discuss the basics, just like finances and medical care, and offer it.
Yeah, I think there's a lack, and then again, especially with people that have a chronic condition or are already dealing with something that's really difficult, to do an analysis of or just dealing, like you said, for your mom. I mean, I know probably many of us have helped family members or other people navigate things to being a as you work for Holy Cross, being a patient advocate is what most people need, or they need someone who is, able to help them make those decisions or navigate, call your that's not covered, call the insurance company. The insurance company says, oh, that was CVS that did that. Not, it's like a back, it's a ping pong. And, for older people, it's very difficult to navigate. And again, especially if you're suffering from any kind of chronic illness.
And then add any language barrier.
Or language barriers as well. Yeah. Big need out there. That is a big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.